Uh, Good day, everyone. My name is Omar Pagpinka, and for my topic, I will be presenting about environmental ethics and global health ethics. First is environmental ethics. Environmental ethics is a branch of philosophy that explores the moral relationship between humans and the natural environment. In addition to that, it addresses ethical issues and human interactions with nature. Key issues in environmental ethics are pollution, climate change, sustainability, which have profound ethical implications for public health. I will be presenting more details as we continue with the presentation. And for this presentation, we will be discussing about ethical issues concerning environment. We will be raising questions, fuel debates amongst us. First is pollution. According to the World Health Organization, air pollution ranks first amongst environmental risk, which is 12% of the global burden of disease. Pollution, may include which include air, water, soil, and noise, is one of the most pressing environmental concerns today. Ethical issues related to pollution include first, intergenerational justice. Since pollution often results in long-term damage to environment, which future generations will inherit, the ethical issue is that is it fair to burden the future generation with the damage caused by the current generation? How about environmental injustice? And since pollution disproportionately affects marginalized communities, is it fair or who should be responsible in mitigating the effect? Next is health versus harm. Since pollution not only harms the ecosystem, but the health as well, what is our duty as humans to prevent harm to both? Lastly, corporate and individual responsibility. Who should be held accountable? Is it the government, corporation, or the individuals? This involves moral discussion about how to assign responsibility to ensure accountability for environmental harm. The next is climate change. Climate change represents one of the most urgent ethical challenges today with global consequences. Key ethical issues are as follows. First is global equity and justice. Developed nations have historically contributed to the most greenhouse gas emissions. According to the World Resources Institute, China is the leader, followed by the USA, India, European Union, and Russia. The ethical issue is whether wealthier nations have greater responsibility to address climate change. The next is intergenerational justice. Climate change is a long-term crisis, and the effects will be felt by future generations. Consequently, we have moral obligations to mitigate climate change to avoid burdening future generations. The next concern is, or issue is, human to non-human impact. Human and non-human impact. Climate change affects not only human communities, but also ecosystems and species. The ethical debate here is focused on whether the duty to protect both human populations and the environment. This includes protecting diversity and ecosystem that provide vital services to both humans and other living creatures. Next is sustainability. Sustainability is about meeting current needs without compromising the ability of future generations to meet their own needs. The ethical challenges surrounding sustainability include, first, stewardship versus exploitation. Here, should we view ourselves as stewards of the earth with a responsibility to protect and preserve nature, or whether nature can be exploited for human gains? Conservation versus biodiversity. Should we preserve natural resources and ecosystems for future generations and limit our own immediate benefit. Next is overconsumption. Is it morally acceptable for individuals and societies to continue exploiting natural resources at an unsustainable rate, particularly when overconsumption causes long term environmental damage? Lastly, limits to growth. Some argue that there are natural limits to economic growth and resource use, and that exceeding these limits may lead to environmental collapse. This ethical debate centers on how to balance economic development with preservation of the natural world. In conclusion, ethical issues in environmental health, such as pollution, climate change, and sustainability, are deeply interconnected with public health. Addressing these challenges requires not only technological and policy solutions, but also a moral commitment to justice, equity, and long term sustainability. The next topic will be global health ethics. Global health ethics is a relatively new term that is used to conceptualize the process of applying moral value to health issues that are typically characterized by a global level effect or require action coordinated at the global level. One of the most pressing ethical issues in global health is ensuring equitable access to health care. This includes our ethical issues are as follows. Number one, health equity. Health equity is the state in which everyone has a fair and just opportunity to attain their highest level of health. All populations, especially marginalized and vulnerable groups, should be ensured to have access to essential services, example, the homeless, the elderly, also the IDPs or the internally displaced, especially during these times of war, Ukraine, Middle East, and in other places where conflict exists. The second issue is universal health care coverage, or the UHC. The main goal is to provide essential health services without causing financial hardship. The ethical question here is how to allocate resources in resource-constrained settings and who gets prioritized when services are limited. Lastly, health as a human right. Many global health advocates argue that healthcare is a fundamental human right, which challenges systems that limits access due to cost, geographic location, and political barriers. The next ethical issue is international research ethics. Since global health research often involves the diverse populations in low middle income countries or LMICs, it raises ethical concerns related to one, informed consent. Informed consent is ensuring participants understand the risk and benefits. In many cases, participants in LMICs may not fully understand the implication of the research, or their ability to give informed consent may be compromised by language barriers, cultural differences, or limited education. Hence, these concerns should be addressed. The next ethical concern is exploitation and justice. Global health research may sometimes exploit vulnerable populations where the benefits of research accrue to wealthier countries while the risks are borne by poor communities. This raises questions about justice and fairness in the distribution of research benefits and burdens. Lastly, benefit sharing. Ethical concerns also arise around ensuring that populations contributing to research, particularly in terms of biological samples, also benefit from the outcome, whether through access to the products developed, such as medicines or vaccines, or through improvements in local healthcare infrastructure. The next ethical issue is global health governance. Effective governance is essential for addressing health challenges that cross national borders, such as pandemics, climate change, and antimicrobial resistance. Ethical issues in health governance includes first, accountability of global health institutions. International organizations like the WHO, Global Fund, Gavi, or Global Alliance in Vaccine and Immunization play a central role in setting global health policies. However, questions often arise about their legitimacy, accountability, and transparency. The question is, who has the authority to make health decisions on behalf of the global population? How can these institutions be held accountable to both countries they serve and the people they affect? Next is sovereignty and global solidarity. Countries may prioritize their own interest over global health priorities. For example, during the COVID-19 pandemic, wealthier countries hoarded vaccines while poorer countries struggled to access them. This raises ethical questions about solidarity, fairness, and the tension between national sovereignty and global common good. For example, here in Qatar, 20, uh, December 2020, we started the vaccination, the mass vaccination. Well, I think in the Philippines, that was first quarter of 2021. But I think Qatar compensated by donating a huge amount of vaccines to Gavi. The next is trade and health. Global health is also influenced by trade policies such as patent laws, which can affect the availability and affordability of life-saving medicines. The ethics of intellectual property rights and their impact on public health are a central concern as these policies can limit access to essential medicines, especially in developing countries. Lastly, emergency humanitarian response. Global health ethics is especially relevant in emergency contexts such as natural disasters, war, or disease outbreaks. Here, our thoughts are with those who were affected by these disasters, especially the man-made one. Some of the ethical issues include triage and resource allocation. In emergencies, health systems may be overwhelmed, requiring tough decisions about who receives treatment first. How do we allocate resources fairly and justly in life and death situations? Do we prioritize those who can be saved, those who are most vulnerable, or those who have the best chance of survival? Next is ethical challenges in conflict zones or impartiality in conflict zones. Healthcare delivery in conflict zones raises concerns about the impartiality of care, as health workers may face pressure from one side or another. Moreover, the safety and of health workers themselves can be a risk in conflict zones, raising issues of moral responsibility and professional duty. In conclusion, global health ethics is essential for addressing health challenges that transcend borders. Ethical principles must guide global health interventions and policies to ensure equity, justice, and respect for human dignity. And lastly, ongoing dialogue and collaboration are necessary to tackle global health issues ethically. Thank you very much.